Hi, I'm Felicity, a registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Eyelid ptosis post anti-wrinkle injections. Let's dive right in to one particular case of a woman in Chicago who had an adverse event after her anti-wrinkle injections, and this has been shared on Instagram. So what happened? So she had been having anti-wrinkle injections for 3 years with absolutely no issues. And she had been seeing the same injector for about 12 months, again with no issues. Now she went along and she had her frown and forehead, her usual treatment. And then she returned 2 weeks later for a checkup appointment, which is a very standard process. And you would know this if you've had treatment before. Now at that checkup, they noted that one eyebrow was sitting lower than the other, and she said on Instagram that she likes quite a lifted brow appearance. And she was told by the injector that some extra units of anti-wrinkle medication could be added to the brow that was lower to raise it to meet the other one. Now this is a very standard practice again, but one we have to be so careful with as the risks are higher when we do go around and do these top-up type treatments. Now, and particularly in this area. Now, in the following days after the review and the top-up she received, this woman unfortunately experienced an eyelid ptosis. Now, this is extremely rare and you've probably never experienced this before, even if you've been having treatment for quite some time. Now, what is an eyelid ptosis? So what it means is the muscle that opens the eyelid has been affected by the anti-wrinkle medication and basically closed. It has drooped, and we refer to that as an eyelid ptosis. So she returned to her injector, obviously, and then she also after that had some reviews with some other doctors and also some plastic surgeons to get more information on what may have gone wrong in this case and also what could be done to improve her situation. Now, it was concluded that either too much anti-wrinkle medication was placed into that area at the review appointment, or the injection was placed in an incorrect spot. Now, there is not a lot that can be done to resolve this situation, as many of you may know that anti-wrinkling medication cannot be dissolved, unlike our dermal fillers can, and that time is honestly the best thing. You do have to just wait it out, and that medication needs to wear off as it usually would. Now, if you have a look at those photos and videos that she has shared on Instagram, you will see that her other eye was overcompensating and opening extra wide. So one was closed like this and the other one was really, really wide, which made the situation look probably even worse than what it actually was. Now, she said that she was told by one plastic surgeon who reviewed her that it was the worst eyelid ptosis case that they had ever seen. And they'd been injecting a very long time. So since this has happened, she has tried a series of eye drops, in particular some prescription eye drops, which can help to open the eye. She has also had very careful placement of tiny amounts of anti-wrinkle injections around her eye to help open that area, and also has been doing stimulation of the muscles around the eye to also help the situation. So how can this scenario be avoided? So correct dosing and placement is obviously the most important thing at the time of injection at your appointment. Then afterwards, being so careful with top-up treatments. Many of you know that have seen me that I will actually decline top-ups in a lot of cases because the risks outweigh the benefits of adding more and causing any of these type of events. Now, following your post-care, we say these things for a very particular reason. So no laying down for around 4 hours after your treatment. So that's on your back or on your face, and avoiding exercise for about 24 to 48 hours after, and avoiding things like facials, massages, having your brows done, other face treatments for at least 2 weeks after, because as many of you know, that anti-wrinkle medication can take up to 2 weeks to have effect. So if you're having those treatments in that period where these muscles are being pressed and moved around, there is a chance that these things could happen to you. Now, this was obviously shared on Instagram for educational purposes, and please note that it is a very extreme case. This risk obviously does come with all of the treatments. It is on the consent form and your injector will go through that with you before your treatment, but you do have to be pretty unlucky for this to happen to you. So in your consultation, make sure that your injector is discussing these risks with you and also the post-care that you need to follow. And make sure you ask all your questions at the time of your treatment. And final take home is, do remember that this is a medical treatment, not a beauty treatment. So these risks do need to be taken seriously. And these risks, like any other medical treatment, are things that we have to talk about prior to your treatment. So I hope you found this case interesting, not to scare you, but just be educational. Go and have a look at this woman's Instagram. She has so much on there about her journey. I've certainly been following it over the last few weeks and looking for those updates. Things are certainly looking better for her at this point in time. If you did enjoy this video, please give it a thumbs up. Don't forget to subscribe for more and drop any comments below, whether it be about this case or any other questions that you might have.